Hi, I'm Jim Nolan, president at Southwestern College in Santa Fe, New Mexico, where we do master's degrees in counseling and art therapy counseling. And I had a couple of things that I wanted to talk about today regarding our school, regarding our programs. The first thing is that a lot of times when we talk about Southwestern College, we place a heavy emphasis on what we do differently. We do a lot of things differently, so it's tempting to do that. We have the vision quests in the eco-psych program. We have the consciousness classes, the psychology of consciousness courses, which are very central to what we do and very important. As you know, our mission is transforming consciousness through education. So we talk about the things that we do that are different, and you can hear a lot about those in several places. And one of the things that I wanted to talk a little bit about here was the fact that we are really strong clinically. We kind of take that for granted and forget to mention it sometimes, I think. I'll give you an example. Recently we did a survey of a number of institutions, organizations, mental health agencies in Santa Fe, Taos, Albuquerque, northern New Mexico, people who have used our interns and hired our graduates to work at these agencies. And we asked them two questions. We asked them a lot of questions, but two of the questions we asked were, would you be willing to accept interns from Southwestern College in the future? And every single agency, every single supervisor responded, yes, we would be happy to. And when we asked about our graduates, would you be willing to hire graduates from Southwestern College, every single agency, every single supervisor responded, yes, we would be happy and interested in hiring your graduates. In fact, most of them said, we already have. We do it on a regular basis. So that was a very strong confirmation that the things that we do at the school do translate well out into the clinical area and out into the agencies. I think sometimes it's a little difficult because 2 years, which sounds like a lot of time, is not a lot of time to learn everything that there is to know about doing clinical work. Those of you who are clinicians know that. It goes without saying. But sometimes I think people feel like, oh, we wish we had more DSM training or treatment planning, and we are increasingly bringing those things in. We brought them in a lot, weave them into a lot of courses. But one of the things that happens out in agencies, as many of you know, is that the way somebody does assessment, the way somebody does testing, the way somebody does intakes, the way somebody does their diagnostics, this varies from agency to agency, from clinician and supervisor to clinician and supervisor. So oftentimes when you go to any particular job site, you learn a new way to do those things, and that's just the way it is. But we feel like we give a really strong basis in those areas, and it's one of the things that we don't mention. Another piece about that is that a lot of our graduates end up in leadership positions fairly quickly. It's amazing to me because I've been involved with a lot of graduate programs in my professional life, and in fact recently we just inquired of our graduates where they work and what their titles are. We were collecting information for the Higher Learning Commission, who just wants to know stuff like, what do your graduates do? And it was amazing the stuff that we get back in terms of where people work and what they're doing and their level of responsibility. So I felt a great deal of institutional pride in hearing where people were working and what they're doing and the way they've been able to use their clinical skills. Another thing that people do here often, as you probably know, we have certificate programs in grief, loss, and trauma. We have the children's mental health now, the interpersonal neurobiology, somatics, and action methods. We have the gift of grief being offered out of Albuquerque, the transformational eco-psychology, and a lot of our students take certificate training and add that to the master's degree in counseling or art therapy / counseling and really potentiate the learning experience, really build a separate area of clinical skills and expertise and knowledge and experience, and use that to advance their careers and expand their scope of influence and practice. So we do a lot of great things clinically here, and I just felt like I wanted to say that so that people knew that in addition to doing some of the really interesting things we do, the opportunities to meet indigenous healers and learn about working with indigenous populations, and so I just wanted you to know that we do the clinical piece really powerfully. In fact, the chair of the board of counseling and therapy practice for the state of New Mexico is on our board of trustees. So he's there and witnesses what we do all the time. He's taught at the school in the past. So it kind of gives you an idea that we're pretty well aligned with the national accrediting bodies, with the national people who set guidelines for counseling programs and art therapy programs. You know, we're accredited by the Higher Learning Commission and the American Art Therapy Association. So I just wanted to give you that idea, because once in a while I hear people say, it sounds really interesting, will I get the clinical skills? And I think I'm here to tell you that yes, you will, and especially if you are interested in one of the certificate programs, you can make that really powerful. So that's just a little bit about the clinical training we do here at Southwestern College in Santa Fe, New Mexico.